Hello, my name is Jeff Dean, and I would like to extend greetings to you from the American Board of Pediatric Dentistry. The purpose of this presentation is to give you a brief overview of the oral clinical examination section of the American Board of Pediatric Dentistry's certification process. Oral performance examinations have been shown to be a valid and reliable means to assess candidates' clinical performance when appropriate psychometrically valid standardization and reliability measures are taken. We use an oral examination in our certification process because clinical application skills can be tested effectively. The oral clinical examination is composed of two separate one-hour sections administered back-to-back. Each section is administered by a pair of trained examiners and consists of 4 various clinical protocols or vignettes that are presented to the candidate for discussion. Questions and acceptable answers are developed for each of the key features of a vignette, and candidates receive a score of excellent, satisfactory, insufficient, or unacceptable for each of these 3 areas: data gathering and diagnosis, treatment planning and management, and treatment variations and complications. Examiners will present a brief medical dental history and ask the candidates related questions. Many, but not all, of the vignettes will include digital images. The candidates will be permitted to ask pertinent questions about the patient and request that images, if provided, be revisited. When possible, examiners will utilize open-ended questions to obtain information on candidate skills. Candidates will benefit by giving evidence-based answers and occasionally citing references to support their rationales. Candidates will be expected to have expert knowledge of all currently acceptable modalities of therapy, whether they perform them in their practice or not. The board has employed a professional testing organization to develop a format designed to ensure the reliability, validity, and objectivity of the exam in order to identify those individuals who possess the necessary knowledge, skill, and ability to achieve diplomate status. The oral clinical examination is criterion referenced to ensure that successful candidates consistently meet the standard necessary to achieve board certification. The criteria for successful completion of the examination are built into the standardization and examiner calibration exercises at the beginning of the examination week and prior to each day's exams. The following abbreviated candidate examination is presented in an attempt to give you a better understanding of exactly how the examination will be administered.
Doctor.
Nice to meet you, Dr. Turner.
Hi, Dr.
Kelly
Smith. I'm Jeff Dean. It's nice to meet
Nice
you.
to meet you,
Welcome.
Dr. Dean. Thank
Before we get started, could you let us know if you have any conflicts with either Dr. Turner or myself serving as your examiners this morning?
I don't have any conflicts.
Okay, great. If you
Okay.
want to go on around to the far chair and have a seat. There's a note paper and pen
Okay.
for you. You're welcome to take notes during the course of the examination.
Okay.
Okay, let's go ahead and get started. This is case 1, and this healthy 2-year, 4-month-old male presents for dental care in no acute distress.
Okay.
His parents are concerned because his teeth are, quote, breaking off, end
Okay.
quote. Could you tell us what other types of additional information you'd like to know about this patient?
Okay. First thing from mom and dad, I need a medical history. Just is he taking any medications at this time? What medications? Any lung, liver, kidney, heart? A lot of times, we'll sometimes ask if they had, if they were full-term delivery. Have they ever had any hospitalizations? Anything like that. And then we usually ask for a dental history. Is this the first visit? If not, how often have you gone to the dentist? And then I like to address the problem. So since they said that he has teeth that have been breaking off, has the child complained about any pain? How long has this been going on, or how long, until they noticed it? and what their main concerns are, and I guess their main treatment goals.
Any other parts of the dental history that you might want to know about?
I guess the important thing to know would be, let's see, and sometimes we ask what area they live in, whether they drink fluoridated water, diet, things like that.
That's fine.
Okay.
I'll go ahead and move on.
Okay.
I'll give you some additional information.
Okay.
This child was exclusively breastfed until 2 months ago
Okay.
and slept in his parents' bed. Since the arrival of his younger sibling, he's been drinking juice in a bottle.
Okay.
And the parents say that they're unable to brush his teeth because he's too uncooperative to let them do that.
Okay. Okay.
Can you talk a little bit about what your next steps might be in evaluating this patient?
So now that I've gained a thorough history, I would attempt to get x-rays and also talk to Mom a little bit further about if she's, you said he'd been breastfed up until 2 months ago,
Mm-hmm.
is that correct? If she breastfed through the night. And it also sounds like you said she had difficulty brushing anyway, so I guess, a little history of the oral hygiene. How often do they brush? Are they able to brush well? How are they doing it? Those sorts of questions. Like I said, earlier, diet, and you said that they've been drinking a lot of juices. So I may talk to Mom a little bit here initially just about, some of the recommendations, and then, proceed with trying to take some x-rays, see if the patient's cooperative, and
How would you decide what radiographs you want to take?
it depends on the teeth that he has present, and usually at 2 years and 4 months, he probably doesn't have his second primary molars all the way erupted.
Let me
So-
go ahead and show you an intraoral view.
Okay.
The
Okay.
upper is his maxilla and lower's the mandible.
Okay. Well, he has pretty good spaces, it looks like, between his posterior teeth. And so I don't think it's really necessary to take bite wings. But due to the extent of decay, I would try to get, PAs, if possible, on this patient, and obviously occlusal x-rays. And I would probably try to get an anterior PA as well, if possible, on this patient, just, looking at his...
Are there any particular guidelines that you use to help you try and decide what radiographs?
Well, like I was saying, that one thing you can definitely know is that if there are spaces between the teeth, it's not really necessary to take the bite wing x-rays, because you should be able to look clinically at the interproximal spaces. So,
All right.
Okay.
Let's talk a little bit now about, could you tell me what the diagnosis is, what you think the diagnosis should be?
It definitely looks like he has early childhood caries. It's affected his, obviously his anterior maxillary teeth here, and then the posterior molars. So it looks pretty, classic, like early childhood caries.
If you had to assess his risk.
Oh, high risk for caries risk.
Mm-hmm. And what things contribute to you deciding that?
Diet and habits, but most importantly, just the number of lesions, active lesions in the mouth.
Okay, thanks. We're done the first skill set, so just hang on just a second.
Okay.
Okay, the next section is treatment plan and management. And let's talk not specifically about your restorative plan right now, but let's talk about how you might manage his behavior based on the history you know so far.
Okay. Well, judging from the fact that Mom said it's not very easy to even brush the teeth, there's kind of, I would just talk to Mom and tell her that, this patient needs an extensive amount of work, and he's very young for the amount of work that he needs. I like to, many people will take patients automatically to the operating room at a young age, and especially with this amount of work. But some, like to do a sedation, try a sedation visit, see how the sedation visit goes. It's sometimes hard to do, if it's going to be 4 quadrants of dentistry, if it's going to take you, 4 appointments, it might be more difficult. But I always like to talk to the parent and just say, we can try a sedation visit and see how well the sedation visit goes. Because of the amount of work, if it doesn't go well, just be prepared that we may have to take this child to the operating room for treatment.
And let's talk a little bit about some of your specific restorative recommendations. And to do that, why don't we take a look at the radiographs for this case. This is a dentogram that just to help us focus in a little bit on exactly what we've predetermined is a cavity and isn't, so just get a general feel for what that looks like.
Okay.
And then let's look at the radiographs. And we can go back to previous pictures if you'd like to do that.
Okay.
I'm not looking for specific details if you can't quite see it. I'm really more concerned the things you're thinking about as you're looking. Yeah.
Okay. I think I'm going to definitely, I would obviously be more aggressive with this child because of their high caries risk, because of the mom, admitting that she has a difficult time brushing the teeth. Just looking, it's a little tough to see some things, but I would say, quickly at a glance, I would probably put stainless steel crowns on most of the posterior teeth if they can be saved. If I decide that they, are salvageable, I would put stainless steel crowns on all of those.
What makes you decide to go that route?
Because of his high caries risk and the background, like Mom said, it's just an all-over cover for the tooth. And I think it's going to be better able at preventing, cavities in the future if she's not a good brusher, and if we leave exposed tooth surface there in the mouth, and we, maybe just if I did a filling instead of a stainless steel crown on some of those posterior teeth, I don't think the filling would last very long. Just judging from the history that Mom has given me, and by the parents right now, and it looks like in the anterior, those teeth. Maxillary teeth are probably going to have to be extracted. In looking at these x-rays, there just doesn't look like there is enough to be, enough left that can be saved.
All right. Let's move on just a little bit, and for the purpose of this case, make the assumption that we're going to go to the operating room.
Okay.
It's the day of the procedure. What type of things before you get into the operating room might you do to prepare for the procedure?
For the visit?
Mm-hmm.
I guess I'm a little confused by the question. I would definitely have Mom have a medical checkup and have a physical by the physician. Is that?
That's the type of thing.
Okay.
Yes.
Okay. Yes. If I haven't already, I would obtain a very thorough medical record of the child, and then I think it's always nice to have Mom visit the physician so that we can get a physical obtained by the physician. And I like to talk to the parents and brief the parents ahead of time exactly what an operating room visit is like, and the risks and benefits, of going to the operating room. Let's see.
How about now the child's in the operating room and the anesthesiologist has put the child under and has turned the case over to you. What are the first few things you do before you start restorative care?
I first just kind of take a quick intraoral, just look at all the teeth and the soft tissues. Then I obtain radiographs. If I wasn't able to before, or if I felt that the ones I took before just weren't diagnostic or clear enough, and then develop a treatment plan from there, from everything that I obtained from that.
And you've developed your treatment plan and you're ready to sit down and begin the restorative care. Is there anything else that you might do?
I
That's okay.
usually no.
Let's go ahead.
Okay.
We're done this section,
Okay.
so we'll go on to the treatment variations and
Okay.
complications.
Okay.
That evening, after the operating room procedure, it's been, say, 6 hours post-op, and mom calls you at home to tell you that her child has a fever. What types of things would you talk to her about?
Just ask mom the onset of the fever, how long ago, when did it start? Has she given any medication? Is the child complaining of any pain? What medication has she given? How long ago? Those sort of questions. Just how are they behaving? How are they acting? What is the temperature? What exactly reading did she get?
Okay. All right. And she responds that she gave the child Tylenol
Okay.
An hour before, and the fever doesn't seem to be changing at all, and her child is pretty lethargic.
Okay. I would probably recommend to mom that if she feels at all that the child is not doing well, then to bring them back up to the hospital, and I'd probably meet them there just to also see how the child is doing. But sometimes after treatment, it can they can get a little bit of a fever, especially at this amount of treatment and with extractions and things like that. But if she had given them Tylenol and she doesn't feel like it had helped at all, the only other option is she could alternate between like a Motrin and an ibuprofen. But if she'd just given the Tylenol about an hour before, then and she hasn't seen a result. And also ask how much she gave too, just to see if she had given enough that might
All right. Let's look at a little different situation.
Okay.
She calls the following day, and on one of the first primary molars, you had decided to do pulp therapy in a stainless steel crown, and mom relates that now the child has some pain and swelling in the area of the pulp therapy.
Okay.
Could you talk a little bit about what you'd recommend to mom at that point?
I would definitely like to see the child, because sometimes pain and swelling for a parent could just be that the gingiva is a little bit rolled around the stainless steel crown. So I'd like to see the child, probably take another x-ray if I do suspect that there is something, that looks abnormal. If the tooth is abscessed, there's kind of a couple of things. One, if you feel that the tooth really needs to be saved, you could attempt to form a pulpectomy. But if you had to see this child in the operating room, I think that the odds of being able to perform a pulpectomy are going to be pretty slim. And then, you may have to extract the tooth on the child if it is abscessed.
And let's just briefly talk about one other scenario, and I'm going to switch things quite a bit
Okay.
again on you. You decided to do this case as a sedation,
Okay.
and the child's oxygen saturation levels went from 97 to about 88.
Okay.
What types of things might you think about doing?
First thing I'm going to do is just look at the child, just to see, their color and check that it's normal. Reposition the head. Also, at the same time, I can ask someone, check the equipment. Let's just make sure that it's still working. If at that point maybe the child's saturation hasn't increased, turn to put them on 100% oxygen and monitor the child and see if that starts to help the child to breathe better. If repositioning the head and checking the equipment hasn't made a difference. And then hopefully by putting them on the full oxygen, that will increase the saturation.
Okay. Our time's up, so
Okay.
we're going to stop on this first case.
Okay.
Thank you very much.
Okay, thank you.
In conclusion, let me thank you on behalf of the American Board of Pediatric Dentistry for taking the time to get to know and better understand the oral clinical examination section of the certification process. Please contact the American Board of Pediatric Dentistry Headquarters Office if you have any questions.